Hello guys, welcome back to my channel. Let's jump into today's video. So today's video, I am going to give you guys some tips on how to get the most out of your field works. Okay, so what I'm going to do is I am going to talk about level 1, and then I may break the video up into 2 and talk about how to get the most out of your level 2 field works as well. So this is very therapy based. And so yeah, definitely some of the tips you can definitely apply it even if you're not a therapist or didn't go to therapy school, so OT school or PT school or speech school, you can still apply it. I'm not sure if physical therapy and speech therapy also do like the level 1s and level 2s, but I know OTs do. But like I said, some of the tips are definitely general tips that you can apply if you're doing your clinicals or your field work, whatever you want to call it. Okay, so let's get into the level 1 tips that I have for you. As a level 1 field work student, this is your second time that you're going to be in the workforce, okay, in the clinical setting with other clinicians. So the first time was when you did your shadowing. So this would be your second time in going to like the clinics or hospitals or wherever setting that you are at, sometimes even in the community. Like when I did my field work, I did one in school. I did a preschool, hand therapy, community. I think that was it. I think those were the 3 that I did as a level 1 student, okay? And then my level 2, I did in a skilled nursing facility and a center for people with developmental disabilities. So I know with level 1s, there's a lot that you cannot do. So your CI, clinical instructor, will let you know what it is that you can and cannot do. Now, if at any point you feel like you're not clear about what you can and cannot do, you need to establish that. Sometimes level 1 field works are like a week or 2 weeks, or sometimes it's like a whole month, but you're doing like twice a week, for example. So whatever time that you're supposed to do it, whenever you go in, so like the first day, make sure that you establish those expectations with your CI, like what can I do and what can I not do, so that you make sure that you're doing what is being expected of you to do, right? You don't want to just be in the little corner and not doing nothing and just kind of watching. Maybe your clinical instructor may want you to do a lot more, but they may want to wait to see if you take the initiative to do it. So if there's ever like, I don't know, should I do it, should I not? Just ask them what the expectations are and what you can or cannot do, okay? Just so there's no confusion there. Also, based on what setting that you're going to, something that you can do beforehand is to call your CI ahead of time and ask them what are the commonly treated diagnoses that they see in that particular setting, because that would give you some time to read up on those diagnoses and get a feel for what the symptoms are and what you may or may not be seeing, okay? And then you can write a little notes that you can take with you, so that if you do see a patient who has carpal tunnel syndrome, for example, you will know what it is and what's really going on, because the CI may or may not have the time to explain to you in depth what it is and what you're looking at, okay? So take the time to do that kind of preparation to get yourself ready for it. Take it as a job, okay? You have to pass your level 1 field work. So take it as if you're going to a job or you're working for some kind of profit. This time you're working for a grade, which is also very, very, very important. And so because you are working for a grade, make sure that you take it serious, make sure that you show up on time, make sure that you're professional, make sure that you respect your patients and your CI, make sure that you are a professional, okay? As a graduate student, you're supposed to act professional anyway, and so make sure that you take that professionalism into your level 1 settings as well. Make sure that you don't have your phone out at all, unless there's a reason for you to have it out. So unless like you have a timer on your phone, and maybe you're working with a patient and you have a timer on your phone, or maybe your CI asks you a question and asks you to go on your phone and you're trying to like look it up or something, like there should be a reason why. And if you do have the phone, make sure that your CI knows the reason why you have the phone, because if I'm your CI and I see you on your phone and I don't know that you're looking up a diagnosis, I'm gonna think that you're just texting someone. That's what a lot of people think when you have your phone, right? They're probably texting, they're probably on social media, media, and you're probably not, because there's so much more that you can be doing on your phone, but I don't know that, so I'm going to assume the words because I'm a person and that's what we do. So before you get on your phone, just tell your CI, hey, is it okay if I go on my phone and look up this diagnosis? I've never heard it before. And he or she may say yes or no. So whatever the answer is, then you take it and then you move on with that. So just always make sure that you play it safe. Okay, it's better to be safe than sorry. All right, okay. Make sure that you are engaged when you do your level 1 field work, meaning be engaged, be present in whatever it is that's going on, even if you're not interested. So let's say if you are doing a hand therapy, if you're doing hand therapy, you're in a hand therapy clinic and you are not interested in hand therapy, it does not matter if you're not interested in hand therapy. You have to be present and you have to be engaged in learning whatever it is that is being presented to you. Okay? Don't make it obvious that you don't care and you don't want to be there, even if that's how you really feel. Be present, be engaged, be respectful. Because you can always learn from it. Even if you're not interested, you can always pick up something from it. And you never know when you may see that again. You never know when that might be on a test that you have to take. So take it serious, learn from it, and yeah, it's a great opportunity to learn, so why not take it? Yeah, this is your time to definitely start networking. Networking would take you far, especially if you want to be able to start your own business and things like that. You want to take networking serious, and this is your great opportunity to start that networking and get to know the therapist in the clinic, get to know people, be nice to people, be respectful to people, and also to your patients. Your patients may be people that you may see 10 years down the road, 5 years down the road when you are practicing as a clinician, and people remember things. So make sure that you keep all those things in mind. I always say that the therapy world is so big but so small at the same time. You never know when you may meet that person outside of your level 1 experience. You may meet them on an interview. Okay, they might be the person interviewing you. You may meet them at a networking event, a conference. So always be on your best behavior as much as possible. They may be the one that's going to give you your next job when you graduate, you know, so you don't want to go in there and act like, oh yeah, I'm never going to see this person, I don't care what I'm doing, because everybody knows someone. Everybody knows someone. It's like a whole connection. It's a whole network. So make sure that you keep that in mind. You never know when you might meet this person again. Always send a thank you note, a thank you email, a thank you basket filled with fruits, or, you know, pay attention to what your CI likes. I did that when I was shadowing. I did that when it was level 1, level 2. I always gave a gift because to me, that's my way of showing appreciation, that I appreciate the fact that you took me in and you took your time to teach me. All right, if this video was helpful to you, make sure that you like, comment, and share. Okay, make sure that you subscribe. Please go ahead and hit that red button. It's free. Thank you guys so much for watching, and I'll see you in the next video. Bye.